Welcome, and thank you for joining us this afternoon for Northwestern's Robert J. Havey, MD Institute for Global Health webinar, Shaping the Future of Global Health, Training the Next Generation of Physician Leaders. My name is Jen Burke, and I'm a member of Feinberg's Development and Alumni Relations team for the Havey Institute for Global Health. Today's event will begin with a welcome from Dr. Robert J. Havey, followed by a presentation from Drs. Ashti Dubey-Prasad and William Leonard, with a moderated discussion afterwards. Now, I am pleased to introduce Dr. Robert J. Havey. Dr. Robert Havey is the Deputy Director of the Havey Institute for Global Health, founder of the Global Health Initiative Fund, and clinical professor of medicine at the Feinberg School of Medicine. Dr. Havey is an internal medicine physician at Northwestern, where he is currently the medical director for Northwestern Primary and Specialty Care, vice president of primary care operations for Northwestern Medical Group, and the Chief Medical Officer of Northwestern's new medical group in Naples, Florida. He is a tireless advocate for global health and for the importance of primary care in all health systems. Northwestern University Feinberg School of Medicine's Havey Institute for Global Health has a mission to expand knowledge and build capacity in global health through transdisciplinary research and education partnerships. Thank you, Dr. Havey.
Yeah, thank you, Jen, and welcome everyone. This is a unique kind of topic, and I think when all of us who have had exposure to global health think about what doctors do to help the problem of poor access to good health care in under-resourced countries, we think of all sorts of things, including clinic visits and building hospitals and doing research projects. But we forget that we can't do any of that if we don't have a pipeline to train the next generation of global health leaders. You don't just wake up one day mid-career and have the experience to handle these things. Plenty of people have the interest, but if you don't have a formal program, you can't move on and you can't establish that transition as somebody who's been at the work a long time retires. Where's your bench? Where's the pipeline to build? So we felt it would be helpful for the audience to really hear from two internationally known experts in this field, Dr. Bill Leonard and Dr. Ashti Prasad Dubey, run the Center for Global Health Education. This is actually the first academic center of its kind in the country, and it's dedicated to just having this transformative education experience and training in global health for a lot of young scientists and doctors that are interested in this work. It goes across the university from the undergraduate level all the way up to PhD programs, from public health to medical degrees. And it really has worked around the world in these low resource centers on establishing these great long-term partnerships that allow us to get the work done. Again, this is not what you think of the first time you hear global health. You picture something different, but this is really the main kind of glue to hold the system together, to have these leaders come up. And so we're going to have the privilege and pleasure of listening to these two leaders about how they built their education center, what they do, and you'll get a taste of what it's done. And then we'll have some questions afterwards. So I'll introduce Dr. Ashti Dubey-Prasad and Dr. Bill Leonard and let them take it over from here.
Hello, greetings everyone. Welcome and thank you again. So I'm Ashti Dubey-Prasad and here with my co-director Bill Leonard. We're going to share a little bit about our work and tell you about how we're shaping the future of global health through training and through training the next generation of physician leaders. And we're going to start with telling you a little bit about the center. So as Dr. Havey mentioned, we are the first and only national center that focuses on global health education. That does set us apart from many. And we were established because we have had a long-standing tradition at Northwestern to have very focused global health programming. And so our center is anchored in the educational pipeline, which engages undergraduate, graduate medical students, public health students, as well as international partners in learning and training in international settings in global health. And it spans our campus, it spans the different schools. So our students, we have students in every school at the university, and then we also are often those faculty are teaching our students. So we have faculty from Kellogg, from Weinberg, McCormick that are teaching our Feinberg students, that are teaching our MPH students. And so it really is this very interdisciplinary, interconnected space. And now we've grown to having partners worldwide, so a global space. And the work at the center is really grounded in long term partnerships with academic centers that are like Northwestern. And so we've had long term partnerships with universities and medical facilities in more than 20 countries over the last decade. And that's where much of our work is centered. So today, what we decided we would tell you about is thinking about training leaders in global health. And we're going to talk about how we train them at Northwestern and the experience of the Northwestern global health student, soon to be leader. But then we'll also share about how we train globally, or what our education looks like around the world. And so I'll be telling you a bit about the around the world part of what we do. So, in when we're thinking about training the next generation, and we're in this around the world section, I'm just going to share a little bit about some of the projects that we're doing and let you know how the center works to partner in education around the world, or a little bit of our model. So, what we typically do is, we are mostly clinician educators on the clinical side of the Center for Global Health Education. And we typically start with finding or working with a partner that's looking to meet a need that we have some experience in. And so it can be many different topics, but it starts with the sort of shared need for training in. There's a gap in the healthcare workforce. They don't know. There's a gap in training for palliative care, which I'll tell you about, or there's a gap in training or education. So that's another one of our projects, but there's a gap. And we work with a partner, usually a partner that we've had some sort of experience with for some time, but we work together to build some kind of partnership with a shared programmatic goal. And it's always a training goal is where it starts. But when we start the partnership, we start with the training goal in mind, knowing that we have a long term vision for sustainability or systems building. And so, whatever the topic is, as we begin to grow and as we start to partner and make these collaborations, there's an eye towards doing this for a long time. And the goal is to strengthen the healthcare workforce, because we're typically training the healthcare providers of the future, or the faculty. And so some of our work, or some of our partners in the work, international partners, have been the University of Global Health Equity in Rwanda, where they run a Master's of Health Professions Education. Stellenbosch University, we work with them also on health professions education, which I'll tell you a little bit about. University of Lagos, which is in Nigeria, and Maseno University, which is in Kisumu, Kenya, and UGHE is in Rwanda, and Stellenbosch is in South Africa. So these are some of our big partners. We work with these academic medical centers to provide training depending on what the identified need has been. So we'll share a couple of examples. So what's health professions education? So it used to be known as medical education. Essentially, it's all about teaching doctors, nurses, physical therapists, whoever's taking care of patients, teaching them how to teach. So all of us are trained as clinicians, but many of us have not been trained as teachers, and we have vital roles in these academic medical centers to teach the next generation. And so one of our big areas of work is advancing health professions education, or how you teach. Um, we do this with faculty in different areas so that they can learn how to better educate their students to provide the best care. And so we're doing this in Kenya, and with our colleagues in Kenya, what we did is we started a small educational program for healthcare providers, and it started with a simulation program on pediatric emergencies. So simulating emergencies and teaching faculty how to teach their young doctors to manage them. And that started in 2019. And since then, the program has now evolved into an annual health professions education conference. We just came back, actually, just came back on Saturday, which is hosted at Maseno University in Kisumu, Kenya. And also, we started we co designed a certificate program for educators there, which teaches this in more depth and advances the faculty in terms of teaching and research. And so that is a 1 year program, and it's been very successful. Similarly, since we're the Center for Global Health Education at a medical school, our space around teaching doctors how to teach well, or teaching doctors and nurses how to teach well, is where we spend a lot of our time. And so we are doing this, as I mentioned, in Kenya, but also in Rwanda. So Rwanda has been has the government has plans to quadruple their health workforce in 4 years, and they wanted to have both a health workforce, a big number of healthcare workers, but they really wanted every worker to have the skills of an educator to teach the next generation of healthcare providers. And so, because of that, the University of Global Health Equity in Rwanda started a training program for these educators, and they started a Master of Science in Health Professions Education there, and a certificate program and a diploma program. And we as faculty have the opportunity to take our skills as medical educators or health professions educators and work with our colleagues in Kigali, Rwanda, to support bringing up a high quality health workforce that provides safe care. Similarly, we started a program, or co-designed a program, in Nigeria starting in 2019 with colleagues at the University of Lagos and at their teaching hospital. We started an online program at that time because of the pandemic. So the program was online, but it was really focused on providing local providers with palliative care skills so that they could practice palliative care for their patients without having to have specialists. And palliative care, for those who haven't heard of it before, or are unfamiliar, palliative care is a special field of medicine that aims to provide relief from pain and suffering, and to improve living, really, for people who have serious illnesses and for their caregivers. And so that is an entirely different topical area, and we began training in that space in 2020. Now, that small online educational program quickly transitioned to an in-person annual training symposium where we facilitate teaching of palliative care skills for Nigerian providers. We've done nursing, basic skills, pediatrics, and this year we're doing communication. This is all co-led by our colleague at Lagos, Dr. Anne Ogbena. And at this point, after these annual symposia and all this learning, a bigger outcome occurred, which is that the teaching hospital established a palliative care consultation service. And so the hospital now has a service, and we are focusing on pediatrics as the next part of that work. And with that, I'll hand it over to Dr. Bill Leonard to tell you about training the next generation at Northwestern.
Great. Ashti, thanks so much. Yes. Northwestern has really been involved in the global health space and training students in global health for over 20 years. 2 years ago, we actually celebrated the 20th anniversary of our undergraduate program in global health studies. Northwestern's engagement in global health really dates back over 25 years. In the year 2000, we received a grant from the National Security Education Program entitled International Health and Medical Cultures, with the goal of this grant being to establish interdisciplinary training in global health that would bridge across Northwestern's two campuses, the Evanston and Chicago campus. This NCEP grant fostered the development of the courses that would eventually become the core of our undergraduate global health studies program, as well as leading to the creation of the initial signature Northwestern study abroad programs in global health in Mexico, South Africa, and China. We formally started teaching global health classes in 2001, and the story that I often tell is that the first quarter that we offered Introduction to Global Health, the course was over-enrolled after a half hour of pre-registration. So what I was expecting was going to be a 10 or 15 student course wound up being a 50 student course, even the first time through. After teaching these courses for 3 years, we quickly realized that there was huge student demand for global health training and curricula at the undergraduate level, leading us to establish the Global Health Studies program and the minor in 2004. From its inception, part of the global health curriculum then, we were the first undergraduate program to require a study abroad as part of the concentration. Fast forwarding years later, in 2016, Ashti's program, the Masters of Science in Global Health, was established. And by 2017, the undergraduate demand for additional curricular coursework in global health was such that we were able to establish a major, an adjunct major in global health studies, as well as at the undergraduate level, creating our accelerated public health program. Our accelerated public health program is a combined bachelor's, master's degree where students apply during their junior year and can begin taking graduate public health courses during their senior year, and then are able to complete their master's of public health degree in a single year. So that was as well created in 2017, along with our concentration in global health in the Masters of Public Health program. And then just 2 years ago, in 2024, we established our PhD certificate in global health, which is open to PhD students in any discipline. The other thing that I would note in this slide, in this photograph, the man in the shirt and tie there is the late Paul Farmer. Paul was our graduation speaker in 2012, our commencement speaker, and this photograph was taken on the Thursday before commencement. Here he is with over 100 undergraduate students in Norris, sharing his perspectives on global health and answering their questions. Dr. Farmer spent a full 2 hours with our students, engaging with them, somewhat frustrating his handlers that day who were trying to keep him on schedule, underscoring both Farmer's commitment to global health, his graciousness in sharing his perspective, as well as the tremendous interest that exists here in global health studies. Again, the interest is also reflected in the growing enrollment. Here we see the increased total enrollments in all of our undergraduate classes in global health studies over the last 10 years, now up to and exceeding 1,200 students a year. the interest is also clearly reflected in the numbers of majors and minors that continue to grow. So we are now approaching 500 majors and minors in our program, making the Global Health Studies program the fourth largest undergraduate major in the Weinberg College of Arts and Sciences. The other part that is remarkable about our undergraduate program is the fact that it attracts students across all interests and disciplinary perspectives. Students in the Global Health program represent all of the undergraduate colleges and really all of the undergraduate disciplines spanning the life sciences, social sciences, humanities, music. We even have some journalism majors. Another signature part of our curriculum from the beginning has been a commitment to experiential learning. So from the very beginning, all students were required to participate in a study abroad program. During the pandemic, we had to put that experiential learning requirement aside, and I'm pleased to say that as of this fall, we are reinstating the experiential learning requirement for all of our undergraduate students. And we have a rich diversity of different opportunities for our students. I'll just highlight a few of them here. During the summer, one of our study abroad programs is in comparative public health in Serbia and Bosnia. This program was developed by my global health colleague, Dr. Peter Locke, and it's focused around global mental health in post-conflict zones. And so students who participate in this summer program take classes at universities in both Serbia and Bosnia, getting the real-world perspective of the impact of conflict on health and well-being in Europe. Let me go back. Another signature program for our students was developed by my colleague, Sarah Rodriguez. This is the Maternal Health in the 20th Century program, where a group of students every year, early in September, travel to London to do historical archival research on maternal health at the Wellcome Library. This experience then is linked to a fall quarter course where Professor Rodriguez works with all of the students on writing up the results of their research project. A really extraordinary and transformative kind of program for students. I will also note that we just received the good news that Professor Rodriguez is receiving the McCormick Award for Outstanding Teaching this year, a university-wide award. And then a third of our experiential learning options really leans into our long-standing relationship with Stellenbosch University. In the spring, we have our public health and human development program in South Africa, which remains very, very popular. In this one, again, as is the case with all of our study abroad programs, it's focused around a particular set of topics. This experience heavily focuses on infectious disease load and its impact on global health. Beyond the undergraduate experiences, the other thing that is very true about the Northwestern experience is that global health is an important part of the medical school curriculum as well. And so this shows the number of students that are participating in global health experiences sponsored through the center. These include both medical students and public health students. We note that there was a drop-off, of course, during the pandemic, but now we're reaching levels that we had seen pre-pandemic for students engaging in international experiences. What we also see is that Northwestern is a national and international leader in global health experiences for medical students. Here we see then on the top line, on the top graph, number of and proportion of students from Feinberg, medical students who are doing global health electives compared to the national average. Consistently, substantial, large percentage of our medical students getting that global perspective, which is really invaluable in terms of their clinical training. We also see that our alumni are making a huge impact in the world. In addition to our training being an important pathway for medical students and medical training, we also see our graduates going on to degrees in public health, graduate schools across the board in social and the biological sciences, as well as many taking up major national awards and fellowships. That our training becomes a really important pathway for students to do Fulbright fellowships, Princeton in Africa and Latin America fellowships, working at the CDC as well. We've had a number of trainees moving in those directions. And so what we see is that our global health program really, from an educational perspective, train students across the entire educational spectrum, from the undergraduate level to training medical students, master's students in public health, and most recently, PhD students as well, equipping students with a knowledge, perspective, and comparative social and cross-cultural skills to really understand and address global health disparities around the world. Thank you very much.
Well, thanks, Bill and Ashley. For the audience, there's a bunch of questions that come in anytime we do one of these webinars, and it's going to be hard to answer all of them. But we'll see how much time we have. I picked out some of the initial ones, and we'll hear comments from Bill and Ashley. One that caught my eye right away, and as I preface at the beginning of this, is that if you don't establish the training and train the next generation of leaders, you can't continue the work. I remember we always remind our audiences that half of the world, I mean, 8 billion people in the world, half the world doesn't have access to modern healthcare. And it really drags down the entire world. Not only is it a humanitarian problem, it's an economic issue, because those countries get kind of left behind because the populations are just not healthy enough to realize their full potential. But not all of our folks that get involved in our Global Health Institute have the time to travel and get involved deeply. So one question came up that I'll read to you, and we can chat about it, is how does training in global health make someone a better doctor or a better health professional, even if they never work outside the United States? And, you know, as a primary care doc myself, I'll take a stab at this first, and because it's kind of personal, because, you know, I got involved in global health 20 years ago, kind of felt it was the right thing to do. We've got just amazing technology at a place like Northwestern and in a big urban area like Chicago, and we've got great doctors. We don't have any big shortage of things, and so the healthcare here is really amazing. And what we can do for people, and even extend life expectancy, extend quality life, is great. But when you're a doc and you've got to handle thousands and thousands and thousands of people, and I get called 7 days a week for, I hate to say it, the last 40 years, you know, how do you kind of recharge? How do you get inspired to keep doing the work we do? Well, I think part of it is recognizing, you know, your blessings, recognizing how well off we are, so that every patient you see, you've got to remember this is a big world. And as a doctor, you're committed to the individual patient that's in front of you at any one time. And it's really great to get these experiences throughout your career, and especially early on, to just remind yourself why you went into medicine in the first place. So I think there's a real value in kind of shaping the commitment of a health professional to their chosen field just by having these experiences. And then I'll ask Ashley and Bill if they have any comments on that question.
No, I think you summed it up really well, Bob. we have one of our exchanges is to Belize, a Hillside Healthcare International, where doctors pretty much do are doing primary care for patients, and we go often enough that it's kind of longitudinal. And one of the residents and one of the attendings, when they left, they said exactly what you said. They're like, this was the best. I feel like a doctor again. I'm truly like inspired to continue to care for patients because I haven't had the time to sit with them in the way that I got to sit with them, and just really re-inspired me um about the patients who I want to take care of and why I do what I do. And so I think we all do what we do to support and provide care, and it is in the most of the places that we work, like the challenges we have here in Chicago, they're like magnified, right? It's like multitudes of hundreds with like poverty and things like that. And so we can really appreciate what we can do as clinicians and remember why we started doing this in the first place. So I think there's a lot of inspiration for the young clinician or the young student when they work abroad.
Indeed. And one of the things that we consistently hear from our undergraduate alumni in global health studies who go on to careers in medicine is how much their global health experiences sort of shaped their perspective on medicine and health, really gaining a greater appreciation of the larger social, structural, and in some cases, historical factors that shape individual access to healthcare and shape downstream disparities in healthcare and health outcomes that we see very starkly internationally, but also are evident here in Chicago and across our nation.
Thanks, both of you. We take for granted at the Institute, and the audience probably is having a sense of kind of what it takes to get these international partnerships going. But somebody asked a great question, said, look, you get these things going, you're partnering in these different areas around the world, but what makes these international partnerships sustainable over the long term? How do you keep it going?
Yeah, I can maybe take a start at that. So we have had partnerships for a very long time, for example, in Nigeria, and some of that long-term partnership or sustainability has been like that partnership getting passed down to the next generation of faculty, for example. And so that the work we do is like it's like beads on a string. So like Dr. Murphy has had who is our institute's executive director, has had a long history in Lagos. And so when a philanthropic grant for potentially palliative care came in and we were looking for partners, we looked to partners that we've already built relationships with. And so that's one way that you keep things going. And of course, the other thing is like relationships and trust, which is just like you've done it for a long time. And then I would say the third thing, keeping it going, has meant for our center intentionally. What we try to do is like our model is like we have this annual training conference. Well, now we're trying to have our partners try to get local sponsorship for that conference in addition to ours, and we're starting a research program alongside. And once we're ready to pass that off, we'll see what the next way we can partner is. But we sort of start something, kind of hand it over for sustainability, and then deepen to go wherever the next step is that our partners is looking to go. And that takes time and money and effort, but so far we've been successful in that kind of a model.
I'm going to turn to Bill. I'm going to have you take this next one,
Sure.
then have Asti join if she has anything. But somebody also asked, as things change, a two-part question: what draws students to global health today? But maybe even more interesting to any of us that have some gray hairs or no hair, is there a different motivation today? Are students coming into global health with different motivations and reasons for doing it than they did 20 years ago, 30 years ago? So You
Yeah,
deal with the students every day, Bill, so you'd be a great one to kind of give your sense of what's changing.
that's a great question. And I think, I mean, to give us the sort of historical perspective, when we were kicking off these programs 20, 25 years ago, I mean, it was very much the influence of people like Paul Farmer and the popular book that was written about his work with Partners in Health by Tracy Kidder, Mountains Beyond Mountains, that really, I think, captured the imagination of a generation of students who, for the first time, were being exposed to disparities in health outcomes around the world. People being sick from and dying from diseases that shouldn't still be a problem in the 21st century. We now fast forward, what is shaping the current group of students? I think our undergraduates and medical students who are currently being trained were obviously strongly influenced by the pandemic and a real reminder of how interconnected we are globally, both socially, but also biologically, and in terms of impacts of disease, and how hugely unprepared we were globally for the pandemic. And I think this has really mobilized. I mean, we saw a huge uptick in the number of majors and minors in our program during the pandemic and immediately following. And I think that has been something that has really, once again, sort of refocused students across different disciplines to come together around this focus on global health.
Great. And then, Ashley, you've been in this a long time, like Bill. I guess you get a little bias when you're at one place and you think you're the best. I think Northwestern's the best, but I'm a little biased. But if you make that statement to anybody in our audience and they come right back to you and they ask you what somebody wrote in today, and that is, okay, put your money where your mouth is. What sets Northwestern apart from other universities who are also doing global health work? How are we different? How are we better? What do we do? What have we learned? Ashley, I'll let you take that one.
Sure. Well, I think first of all, we have, we've already said this, but we have a pipeline of trainers. So we have global health embedded across the university, which may be the case for some, but not for all. Certainly not at like the levels of PhD or having a Master of Science in Global Health. So a couple of things that you'll notice if you kind of hear us talk about it, but the Center for Global Health Education, first of its kind, the Master of Science in Global Health, first of its kind, online, entirely online, and it was so that our partners abroad could do it. So that's a first master's. I think Global Health Studies is probably one of the first programs that have majors in global health. So we're like, we hit all the firsts, and we actually, because we have a space to do the work in, our educational programming is kind of second to none in terms of like availability. So like everyone who's doing something at Northwestern can be involved in global health. And then furthermore, I think from our institute perspective, we do have quite a few interdisciplinary and cross-collaborative partnerships that make us special, but probably our long-standing partnerships make us even more special, that we are committed to working with certain partners, and we've done that for a long time, and we continue to do that for a long time. So that shows like our sort of authenticity in partnerships. But yeah, we're the first of our kind in a lot of areas.
I'll just pipe in and I know that when Bill was giving his segment of this, he showed that picture of Paul Farmer, and he kind of assumed that everybody in the audience knows Paul Farmer because everybody in global health knows Paul Farmer, and I actually had Tracy Kidder speak at one of our events. I mean, Paul Farmer was one of those kind of unique, kind of once in a lifetime personalities where he got really, really passionate about global health early. He was so into it that he set a deal with Harvard Med School that they let him work in Haiti, even as a first and second year med student, and just do his coursework and fly home and take a final and then come back and go back into work. I mean, he was really all in. So he kind of set the standard for global health and established Partners in Health. You know, everybody does things a little bit differently. We've built this up over almost 25 years. I've been involved for 20 years, and we've had great support. And that leads to the next question for Ashji and Bill, which is, you know, we've got this rear view mirror of everything we've done. What do each of you want to see happen to your center over the next 5 to 10 years?
Well, I think for us, our center has kind of developed itself as a model of like training with partners that leads to sustainability. And what I'd love to see is for us to be able to have these programs embedded kind of longitudinally for and with our partners and continue to grow them. So like a sustained space to grow academic partnerships. And then hoping that those places then give room for students. So we're hoping to start, fellowships in global health, getting more faculty in global health who can teach students, but who can be involved. And so really to grow this foundation into like a center that has long-standing partnerships and plans and faculty and fellows who are all dedicated to teaching and learning in global health for partners and for students.
Yeah, I would echo that vision that creating more partnerships, and with those partnerships, additional fellowships that are going to provide opportunities for students at all educational levels to be able to collaborate fully in our global health experiences. I think as well, I mean, we've established a PhD certificate in global health, and I think as part of our center, we would also like to see a formal sort of PhD in global health that would train leaders who are going to be both academic and practitioners in global health to go out and shape the agenda throughout the world.
Great, thanks to both of you on that. And again, as I said at the beginning, interestingly, we had a research application today. Those on the call understand, I think, from hearing me in the past, that we get a lot of requests for funding of a lot of projects. And this was unique today, where we had a research application for one of our innovation grants to set up a research infrastructure in several low and middle income countries. And the point of this is that, we always forget about infrastructure. If you don't have the base built, how can you get the work done? So we can send a great expert on stroke or TB or hypertension or healthy aging or antimicrobial resistance. We can send our specialists around the world, and we do. But if they don't show up at a partner site that has an infrastructure set, how can they do the work? And likewise, if we don't have a pipeline of people who understand global health and serve as our leaders, how do we establish these relationships? How do we get partner sites? You can't just say, hey, 4 billion people in the world need better healthcare and just snap your fingers. I mean, how do you do that? You've got to build the machine. So one of the questions that comes up every time we do one of these webinars, and I'll take a stab first, and then I'll have each of you answer, because this is a little bit up my pipeline, is what has philanthropic support allowed you guys to do for your center? And what could you do with future funding? And I'll just mention, since it is a pitch that I make all the time, first off, out of just incredible respect for our supporters and our audience, we understand there's a ton of very, very worthy things to support, and we are just incredibly grateful for every gift we get from everybody over all these years, for sure. But look at what has happened when the Institute got endowed. We just quadrupled our activity. And when the Primary Care Center, the Ryan Family Center for Global Primary Care, got endowed, we are doing about 20 times the work in that center than we do in any of the other centers, 20-fold, because of that extra support. So, the deliverables, the results speak for themselves, that with extra support, we can get more things done. I would think that Bill and Ashji, which I'll let them answer in a second, will just kind of salivate over all the the dreams and goals and ambitions they have for their center if they didn't have a small amount of funding and we could expand it for them. So this is your guys' chance, Ashton and Bill, to inspire your audiences on the call right now to tell them what you would do if you had more funding, maybe even an endowment.
Well, that would be wonderful. And just as you said, Bob, the two projects I talked about, the palliative care project in Nigeria and the teaching doctors project in Kenya, those are both philanthropically funded from, kind donors. And we have big ideas to make, centers for palliative care, a center for excellence for palliative care in Nigeria. And that's really based upon the educational work that we started. And then similarly, in Maseno, they would like to have a center for excellence for health professions education, but those are within those groups. Beyond that, we'd love to have a way to train a clinical global health education fellow. We would love to start a journal, our Global Health Education Day, which is actually very successful. I see that being taken nationally. When I was at a conference, everyone wanted more of what we do. So I would say that if we had an endowment, we could certainly endow our fellowships and we could bring our work to kind of a national scale just because there are no other centers for global health education. And so people are looking for a space to show that work and share that work. And then this is probably most, academic of me, but I'm ready to start a global health education journal because I think there's a lot that can be done there. I'm a journal editor for many journals, and I see people really trying to get their global health education work in. So I think we can just keep pioneering to go to the top and continue these partnerships if we had if we again, so grateful for all the funding we have and all the work we can do, but to make it bigger. So
Indeed. The other thing that I would add, and this is something that we have very clearly seen over the arc of history with our undergraduate program, is how important donor gifts and endowments have been for creating scholarships and fellowships for students to do study abroad and international research experiences, ensuring then that family financial background, social and economic background does not present a barrier for all students who are interested to participate in global initiatives. And it has been wonderful to see then the diversity of students that have made their way through our pipeline, from the undergraduate into graduate and medical school training, from as a product of philanthropy here at Northwestern. And so I think that piece is really, really an important part of developing a pipeline and developing a pipeline with diverse voices in terms of perspective and disciplinary background who are going to be the leaders for global health moving forward.
Great. Well, thank you, Bill. Thank you, Ashty. I think we're going to respect everyone's time and express appreciation for your attention today. And I think it's given you hopefully a little more insight into just one of our many centers. There's kind of a crazy, almost illogical business model to places like the Global Health Institute that the return on investment is a future return. All of our participants, including Bill and Ashty, myself, we do so much of this, just for the good of doing it, for the purpose of doing it. This is not the kind of work where there's remuneration or anything like that. We know that this is helping the world. It's helping our kids. It's helping our grandkids. And we all know the world has a lot of challenges. And if we can make a difference in this field, in the field of global health, with all the different centers we have, then I think we can all kind of feel good that we did what we should have done in life. So all that happens because of the participation of everybody who's watching this webinar. And I know I speak for everyone in the Institute. We had a little call retreat about 3 weeks ago. We added up our members now. And we started with literally 20, 25 people. We have over 700 people participating at the Global Health Institute at Northwestern now. That's a testament to the support we have from people on this call today. So thank you for that. Thanks for your attention. If you have ideas or suggestions or interests of other things you'd like to see us do webinars on, please share them with myself or with Jen or Tiffany, and I'll let Tiffany close out. Have a great day. Thanks again.
Thank you so much, Dr. Dubé-Prasad, Dr. Leonard, and Dr. Havey for speaking with us. If any of our attendees are interested in learning more about the Havey Institute for Global Health or supporting our work, you can please visit us at globalhealth.northwestern.edu. We will be sharing this afternoon's recording, by email after the event. Thank you so much for joining, and we look forward to seeing you again soon.